Rick Komarek, Certified Financial Planner, coming at you with a brand new article that just came out on February 20th from Vanguard Research, taking a look and asking the question, how much does retirement healthcare cost? I mean, many of us have heard the studies that it could be $280,000 that a retired couple needs just to pay for healthcare in retirement. But the reality is that retirees pay for that on an annualized basis. They don't pay for it in a lump sum right when they retire. So let's drill down into the details and see what the cost could be. Today's retirees' retirement confidence is up, so that's a good thing. However, one of their major concerns, according to this PricewaterhouseCoopers study, found that 38% of boomers said that healthcare costs are a top fear, and higher than those that were afraid of running out of money, which originally was the number one fear for retirees. But it doesn't have to be that way, and that's through understanding the various options that are available and having a plan for that. First, I want to highlight this, that health status makes a difference. How healthy you are determines how much you'll end up paying in retirement. If you're a high-risk smoker, 2 or more chronic conditions, the reality is that your cost will be higher than those that are non-smokers with no chronic conditions. So make taking care of yourself a priority for sure, because it pays and it just feels better, right? Now, how do people get Medicare? Well, there's various choices out there. Traditional Medicare with employer-sponsored coverage, Medicare Advantage plans with prescription coverage, traditional Medicare with prescription coverage and a Medigap plan, and traditional Medicare with prescription coverage. So there's various choices out there. It depends on where you live, you know, what your employer was. So it really is a personalized decision on how to get that. Now, here's something important to note, that $5,300 is the amount of subsidies lost at retirement on average. And that has to do with the fact that employers have been carrying part of the weight of the healthcare cost for, you know, this is just on average. So some employers pay all the cost, other employers pay none of it. But on average, the employers are paying $5,300, and they don't do that once you're retired typically. So retirement age, here's an illustration of how the costs can change before retirement and then after retirement. According to this, $12,800 is the median cost that someone would pay before Medicare at age 64. However, once they go on to Medicare, $5,200 is the median cost. So if you're currently paying for your own healthcare coverage, then when you go on Medicare, you're going to see a substantial savings typically with that. However, if your employer is paying for it, then you might see an increase. A second area that turns into the way that Medicare is priced is location. It depends on where you retire, because annual premiums for Medigap plans vary geographically. Each state and area there prices them differently. So it depends on where you retire as far as how much you'll end up paying. Also, how much your income is in retirement will affect how much you pay for Medicare, because Medicare premiums are adjusted based on your income. So if you have what Medicare considers a high income, then they're going to charge you more for your Medicare premiums. They give an example here of an individual. I believe this is a lady who's 60 years of age right now, living in different states, Billings, Montana, Manhattan, Charlotte, North Carolina, low health risk, medium health risk, and high health risk, and then income, high income or low income in various scenarios here. This one retires at 63. Well, she's going to be paying $13,300 a year at retirement. And then when she goes on to Medicare, it'll be $3,400. So she'll see a savings in that regard. In this one, retires at 65 and she'll be paying $4,300. So more for Medicare at that point, and it has to do with the variable of her location at that point. And then the final example they show is a different location once again, but also income is low, and therefore her pre-retirement healthcare cost will cost less because it's being subsidized, but then at retirement, her healthcare costs go way up, and that has to do with her health status as well, a high health risk in there. So you can see all these variables, as you mix them and match them, they affect the pricing of how much you'll pay. So remember this, cost will vary. They'll vary for everybody based on your income, your location, and your healthcare, your health risk status. Consider healthcare options before you retire, know what they are, and as healthcare costs rise, Don't be too overly concerned about that because typically other costs can go down in the future as well. So just my best advice is to plan for what it is today and, try to maintain that as much as possible. Make healthcare spending a part of your budget. Don't view it as a lump sum. View it as an annual expenditure that you need to make. Long-term care costs, that's a whole different area that would need to be looked into. So if you have any questions about retirement, healthcare, spending, investing, saving, insurance, feel free to reach out to me anytime.